Hello, this is Dr. Surbi, and this is an update video on the novel coronavirus disease 2019. This video aims at providing all the important facts and updates on the COVID 19 for NEET-PG and UPSC medical science optional students. As the situation of COVID 19 is dynamic and what we know today may not be accurate next week, so it is necessary to keep yourself updated and also to keep uncovering the latest information on the virus. So, in this video, I'll cover all the latest facts of the COVID 19 and also share you the situation of COVID 19 in India and what strategies are being taken in India to combat the disease. So let's start. The outline of the talk, we will start with the virus itself. So the coronaviruses, they're not new. They were discovered as early as the 1960s. You should know that the coronavirus derives its name from the word corona. It is a Latin term and it means crown. Why does it have the name? Because it resembles a crown because of the presence of the S protein. On the coronavirus envelope, there are various spike-like proteins of the S protein which gives it a crown-like appearance and hence the name. Okay, so in the early 1960s, there were many coronaviruses that were discovered like the 229E, OC43, HKU1, etc., which commonly caused a mild upper respiratory infection, which were known to be the common cold. In 2003, another coronavirus, that was the SARS coronavirus, emerged in China that was thought to be transmitted through civet cats. Okay, so that was another coronavirus that originated in 2003, that was the SARS coronavirus. And in 2012, another coronavirus appeared that was in Saudi Arabia, that was called as the Middle East Respiratory Syndrome coronavirus, that was the MERS coronavirus. Okay, so this MERS coronavirus was transmitted from camels to humans, and it caused even more severe disease than the SARS coronavirus because it carried a high mortality rate of around 36%. Okay, now in December 2019, the novel coronavirus that was known as the SARS coronavirus 2, SARS-CoV-2, it emerged in China. This SARS-CoV-2, which causes the disease coronavirus disease 19, abbreviated as COVID-19. The COVID-19 is the abbreviated form of coronavirus disease 19. So this is the disease while the virus is the SARS-CoV-2. It has an intermediate animal vector which is not yet identified but is thought to be the Malayan pangolin. So the coronaviruses, they likely circulate in animal reservoirs in which bats were well described natural host. So bats are the well described natural host of coronaviruses, and through an intermediate host species, they finally go to humans and cause infections. So in case of SARS virus, which originated in 2003 in China, it was a civet cat which was the intermediate host. From the bats, it was transmitted to civet cat and then to humans. In MERS, through the bats, it was transmitted to camels and then to humans. While in the latest coronavirus, that is the Wuhan coronavirus, that is called as the SARS-CoV-2 virus, SARS-CoV coronavirus 2, it is thought to be originated from the bats to the pangolins, that is the best described till now, and now transmitted to humans. So this was a cycle that occurred from first originating in bats, that is the natural reservoir, then went into pangolin, which is thought to be the intermediate host till now, but the intermediate host till now is still uncertain, and then it went into humans. So this interaction is thought to have occurred in the seafood market that is the wet market of China in December 2019. In December 2019, cluster of pneumonia cases originated in the Wuhan district on the Hubei province of China. These pneumonia cases, they were of unknown origin because they were not caused by any of the viruses which were previously known. So a new virus which was now linked to the seafood market in the Hubei province was known, that was thought to be transmitted through an intermediate host, that is the pangolin, and then to humans, uh, in which the natural reservoir was bat. This was the novel coronavirus. This novel coronavirus causing the disease COVID-19, it is a beta coronavirus named as the SARS coronavirus 2. Why it is named as SARS coronavirus 2? Because the SARS is the same subgenus as the SARS virus, and it also has a similar structure, as well as it has the same receptor for cell entry as the first SARS virus. There was one SARS virus that originated in 2003, that was the SARS coronavirus 1. This novel coronavirus, that is the SARS coronavirus 2, it is similar to the coronavirus 1 which originated in 2003 in China itself, but there are few genetic differences from the first SARS virus, and therefore it is termed as the novel coronavirus. Okay, the SARS coronavirus 2, that is the SARS-CoV-2 that causes COVID-19, it enters through the same cell receptor as the first SARS virus, that is the angiotensin converting enzyme receptor. It enters through the same cell receptor, that is the angiotensin converting enzyme 2 receptor. Also, the closest RNA sequence resembled the two bat coronaviruses. Because of its closest genetic similarity found to the coronaviruses from bats, therefore its natural reservoir is thought to be bat. First, with the family of coronavirus, it belongs to the Coronaviridae family. It contains a single-stranded RNA gene, and which is pleomorphic. The size is approximately 80 to 220 nanometers, or you can say it is around zero point 0.2 micrometers in size. Okay, 0.2 micrometers in size. This is the structure that has been given by CDC and contains the three proteins, that is the E protein, the S protein, and the M protein. The E protein is the envelope protein that helps in developing the envelope of the coronavirus. Then there's the S protein that helps in attachment of the coronavirus to the receptor, while the M protein, it helps in the development of the membrane, as well as it helps in development of the envelope along with the E protein. Okay, so this was the basic structure of the coronavirus. Now let's study the epidemiology of coronavirus 2019 based on the study done in China. There it was described that the median age affected is 51 years, with an interquartile range of 39 to 63 years, which was most affected. But you should know that it can affect anyone ranging from even newborn to 100 years of age. As per the study in China, it was seen that males were affected around 51%, but there's an equal distribution. It does not different. There's no gender difference that was known, and the healthcare workers particularly were affected, were 3.8%. So because they are in direct contact with COVID-19 patients, so the healthcare workers are the most susceptible to get infected, and the range of effect of the healthcare workers that were affected were 3.8%. In the study, it was also seen that the COVID-19 disease, it tends to be more severe in people who have an underlying comorbidity like hypertension, diabetes, or heart disease compared to those who did not have any comorbidity. So, those people who have an underlying comorbidity like hypertension, diabetes, heart disease, they tend to have a more severe illness as compared to people who do not have any comorbidity. The data, as per situation reports submitted by WHO on 2nd May 2020, it shows that the total number of confirmed cases till date are around 3.45 million, with around 2.43 lakh deaths. Okay, the deaths are 2.43 lakh. This is the latest data as on 2nd May 2020. Uh, there was a maximum increase, that is more than 1 lakh cases increase in the last 7 days in USA, closely followed by the European nations like Spain and Italy, as per the report given by WHO, that is in the last 7 days from 25th April to 2nd May. Now considering the situation of COVID-19 in India. A total of 9.76 lakh samples they have been tested as on 2nd May 2020, out of which 37,776 have turned out to be positive for COVID-19. The case fatality rate in India is at around 3.3%. This is the case fatality rate, that is deaths of around 0.09 people every 1 lakh population. Okay, so a 3.3% case fatality rate has been found out in India. So our case fatality rate, it is quite low. It compares well with some countries like South Korea, which is seen as the top performer in containing the disease COVID-19. So this is the latest COVID-19 situation report in India, and we are hopeful that the infection remain contained. Now let us talk about how the novel coronavirus it is transmitted. The main mode of transmission is person to person. Okay, so person to person is the main mode of transmission. Though the virus is thought to be originated from the natural reservoir bats and the intermediate host like pangolin, from which it jumped to humans, but now mainly the transmission is occurring person to person through respiratory droplets. Okay, the spread of SARS-CoV-2 resembles the spread of influenza virus, that is mainly through respiratory droplets. The transmission route involves infected droplets, aerosols, and direct contact, example through hands, or indirect contact through surfaces. Important point to note here is the difference of infected droplets and aerosols. Infected droplets are mainly produced when a person coughs or sneezes. Okay. When a person coughs or sneezes, the infected droplets are produced, and these droplets are usually large with more than 5 micrometers in size. These infected droplets, being large in size, they can't travel to a distance more than 1 meter. So they travel to a distance less than 1 meter. As these infected droplets they travel less than 1 meter distance, the concept of maintaining a social distance of 1 meter or 3 feet comes. This is the concept of social distancing of 1 meter or 3 feet. That is, if a person coughs or sneezes, his infected droplets won't travel more than 1 meter. Now, second is the aerosols. Aerosols, they are small droplets which are less than 5 micrometers in size, usually generated in hospital settings during procedures, example intubation, etc. And due to the small size, they have a trajectory of more than 1 meter distance. Okay, they can travel more than 1 meter. Thus, aerosols, they have the tendency to spread throughout the room and are more dangerous. Point to note here is that the infected droplets produced by coughing, sneezing, which are more than 5 micrometers in size, they're easily stopped by triple layered or 3-ply surgical masks. While the aerosols, which are less than 5 micrometers in size, they're not stopped by triple layered simple surgical masks, and they do require a N95 mask or higher. Okay, so these were the important points to note. Next, you should know that why the coronavirus is so contagious, because of its long survivability. the virus, it can survive outside the body for 1 to 2 days, that is approximately 48 hours on non-porous surfaces, that is like a table or doorknobs or a mouse or a pen or digital surfaces like the front of a mobile phones or even the laptop surfaces. It can survive for approximately 48 hours. Okay, while on porous surfaces like your clothes, it can survive for 8 to 12 hours. So, its survivability on non porous surfaces is approximately 1 to 2 days. So, it can survive for approximately 48 hours on non porous surfaces, while the survivability on porous surfaces is around 8 to 12 hours. You should also note, although the main person to person transmission that has been found till now is the respiratory droplets transmission, but you should know that SARS coronavirus 2 RNA has been detected in blood and stool specimens also. According to the joint WHO China report, live virus has been cultured from stool in some cases, but fecal-oral transmission does not appear to be a significant factor in the spread of the infection. Okay, so the main mode is only the respiratory droplets which have been found till now, though live virus have been cultured from the stools, but fecal-oral transmission does not appear to be a significant factor in spread of transmission. Now, one very important point to note is that people who are infected can show no symptoms at all, but they still can be infectious. That is the transmission of SARS coronavirus from asymptomatic individuals. That is, the SARS novel coronavirus has been described from asymptomatic individuals also, but the extent to which this occurs, it still remains unknown, and large screen studies, serological studies need to be done to know the scope of asymptomatic spread of the infection. Now, some queries they have come into mind people, and WHO is clearing them one by one. The most common is that, can COVID-19 be spread through coins and banknotes? The WHO says that currently there is no evidence to either confirm or disprove that the COVID-19 can be transmitted through coins or banknotes. However, respiratory droplets expelled from an infected person can contaminate and persist on surfaces, as I have told you, on non porous surfaces for 1 to 2 days. So, you should remember that you should wash your hands regularly and thoroughly after touching any frequently touched surface or object, including coins or banknotes. Avoid touching your eyes, mouth, and nose if your hands are not cleaned. Another query that came into the minds of people was that because Wuhan was a 5G town, and many countries where virus was spreading was also having 5G mobile networks, so the query arose in minds of people that 5G mobile networks may spread COVID-19, but obviously it is not the mode of transmission, and WHO has disproved the theory and said that viruses, they cannot travel on radio waves or mobile networks, and it is spreading in countries that do not have 5G mobile networks. So this theory is totally false, that the 5G can have any connection with the spread of COVID-19. Now, next, coming on the incubation period. The incubation period of COVID-19 is thought to be around 14 days, that is within 14 days, but the most cases, they occur approximately 5 days after exposure. And also to note that the median time in which the hospitalization occurs in people is around 7 days. On around the 8th day, the patient usually develops shortness of breath, and around the 9th day, the patient usually develops ARDS, and around the 10th day, the patient usually requires mechanical ventilation. So the incubation period of COVID-19 is 14 days, and the people, they usually develop the infection, however, in around 5 days period. Okay, and the median time in which the patients they usually require admission to hospital is it is around the seventh day. Okay, seventh day they usually require admission to the hospital. On around the eighth day they develop shortness of breath, and around the ninth day they usually develop ARDS, and around the 10th day they usually require mechanical ventilation. Now, another fact to be cleared is that you can catch COVID 19 no matter how sunny or how hot the weather is. Exposing yourself to sun or temperatures higher than 25 degrees does not prevent the coronavirus disease. WHO has cleared that a heat killing can be done only at 56 degrees Celsius with exposure of around 10,000 units for at least 15 minutes. For quick reduction of COVID-19 virus. Therefore, because the 56 degrees Celsius is quite hotter weather for killing the coronavirus, it may kill the person first before killing the coronavirus itself. Another point here to note is that you should know who is a contact of COVID 19. Okay, a contact is any person who is involved in any of the following. Number one, either the person he's providing direct care without any personal protective equipment for the COVID 19 patients. Or number two, the person is staying in the same close environment of the COVID 19 patients, including workplace, classroom, household, or gatherings. And number three, the patient is traveling in close proximity, that is less than 1 meter distance, with a symptomatic person who later tests positive for COVID 19. Okay, so also you should know that there are two types of contacts of COVID 19 which are there. One is a high risk contact, one is a low risk contact. So usually the high risk contacts are those which usually live in the same household, and any who is in close proximity of the confirmed case less than 3 feet distance, but also passengers who are in close proximity and for more than 6 hours. So, in short, you can say that any person who is at less than 1 meter distance for more than 6 hours, that person is set for with along with the COVID-19 patient. Obviously, that person is said to be a high risk contact of the patient. Okay. So, high risk contact is any person who lives in the same household or is in close proximity at a distance less than 1 meter and for more than 6 hours time is considered a high risk contact of COVID 19. So this was about the important introductory points for COVID-19. Now I'll discuss about the clinical presentation and subsequently on the pathophysiology of COVID-19. That will be covered in the part 2 of the lecture series on the COVID-19 updates. Thank you.